ఇచ్చారు నాకు. ఇది ప్రత్యేకంగా నేను పార్టిసిపేట్ అయ్యే పరిస్థితి కూడా లేదు, మీరు చూస్తూనే ఉన్నారు. ఎందుకంటే కంప్యూటర్లో నేను వేలు పెట్టలేదు. నాకు ఏదైనా ఉంటే ఇప్పటికి కూడా నేను కాగితం మీద రాసుకుంటాను, కానీ లేదు. కొత్త మళ్ళీ ఈ గీతారెడ్డి గారికి, మీ కమిటీ వాళ్లకు, కొత్త కమిటీకి అందరికీ శుభాశీస్సులు, శుభ అభినందనలు తెలియజేస్తూ సర్వే జనా సుఖినో భవంతు.
కృతజ్ఞతలన్నా. థ్యాంక్ యూ అండి. అయిపోయిందా? థ్యాంక్ యూ అండి మనోహర్ రావు గారు. మీరు రావడం మాకు ఎప్పుడు సపోర్టివ్గా ఉంటారు, కార్యక్రమాల్లో పాల్గొంటారు. మీకు మనస్ఫూర్తిగా మా కమిటీ తరఫున, పిసిసి తరఫున ధన్యవాదాలు తెలియజేస్తూ, మరి ఫ్రెండ్స్, there is a little change in the program. We had to finish the program by 1 o'clock. There are more speakers. So to allow the speakers to speak comfortably, ఇప్పుడు మనము అవార్డ్ సెరమనీని ముందుగా తీసుకొస్తున్నాం. So we are going into the award ceremony. I hope our former Prime Minister Manmohan Singh Ji's office is listening. So we would like to now point out to the award that we are giving to our distinguished speaker, Professor K. Srinath Reddy Garu. So someone please focus on the award now. That is the award. And one of our committee members, Mr. Shyam Mohan, who is our intellectual cell chairman and the brother of former late Minister Shri Madan Mohan Garu. Now I request our awardee, as I earlier said, a very, very eminent personality in the field of medicine. We are proud that he has had his MBBS degree from Osmania, as I said earlier. Then he moved on to do MD and DM in AIMS in cardiology. And from then on, nothing could stop him, because he has the rare distinction of being the personal physician to two prime ministers, and that to Congress prime ministers. One is the late P.V. Narasimha Rao Garu, and of course he is also the personal physician of our Manmohan Singh Ji Garu also. And he is an epidemiologist. He's also a task force member for COVID in the present government. And he is the right person to be speaking to us about COVID. COVID విషయాల గురించి కానీ ఇవన్నీ కూడా వారు పెద్ద ఎక్స్పర్ట్, వారు మాట్లాడబోతున్నారు. వారికి నేను ఇప్పుడు ఆహ్వానిస్తున్నాను డాక్టర్ శ్రీనాథ్ రెడ్డి గారు, who is now the president of the Public Health Foundation. We await your memorial lecture and your reply for today. Thank you very much.
esteemed Dr. Manmohan Singh Ji, respected Shri Mallikarjun Kharge Ji, Dr. Geeta Reddy Garu, Chairperson of the PVNR Centenary Celebrations Committee, and Captain Uttam Reddy Garu, who have been the principal organizers of this event, other dignitaries gracing the event as speakers, luminaries adding luster with their presence and participation, ladies and gentlemen. I am greatly honored and extremely humbled by this award, the first ever PVNR Lifetime Achievement Award instituted on the occasion of the late Prime Minister's centenary celebrations. I am doubly honored to receive it from Dr. Manmohan Singh Ji. Indeed, more than any or all of my professional accomplishments, it is the unexpected good fortune of being closely associated with two great Prime Ministers of India that has been my proudest lifetime achievement. Rao Garu and Dr. Singh transformed Indian economy, gained friends, allies, and admirers for India from governments and people across the world. To have moved in their shadows has been my proud privilege. I came into close contact with Shri Narasimha Rao Garu in the summer of 1990 when I had to see him at home one Saturday afternoon when he was experiencing chest pain. When I visited him in his bedroom, despite all the problems that he was having, he was busy typing away on his laptop. Next day in the coronary care unit of All India Institute of Medical Sciences, he was back on his laptop, typing out chapters of his memoirs for his later posthumously published book. I was amazed at his sthita prajna and admired his focused attention to goals. After he became the Prime Minister, I became his personal physician. I was almost the first to see him every morning. I had to travel with him on his travels outside of Delhi and on ceremonial occasions even within Delhi. I had the occasion to see him interact with Indian and foreign leaders with courtesy, calm, and conviction in his ideas. Being a fly on the wall gave me a great opportunity to observe him, to learn from him, and to be inspired by him. Much has been said of his command over many languages, but I was still amazed by the extensive and insightful literary critique that he delivered when he presented the Gyanpith Award to a Marathi literature. He would ask his trusted aide, Mr. Ramu Damodaran, to bring him video cassettes of Spanish films so that he could continue to refresh his language skills. His refined and often wry sense of humor was something I could enjoy in the intimacy of close observation. I could go on about Rao Garu, but I've been asked to speak about COVID in India, so I shall attempt to do that as briefly as possible. Well, the first wave of COVID in India was well controlled because we started a fairly long lockdown very early when our cases were very few in number. But even the winding down of the lockdown in terms of unlocking was in stages, and considerable caution was exercised even later in 2020 for several months. Travel was restricted, large crowds were avoided, and even the festive season was muted. And that did pay dividends in terms of declining cases and death counts by early January, and it appeared that we had put the pandemic behind us, but that was an erroneous impression because the virus was still lurking around. The second wave caught us off guard with both the virus and the many variants that either came from abroad or emerged from within the country, now having an open highway to travel. We know what the devastation of the second wave has been. I do not need to recount it. But we now seem to be seeing the end of the second wave. But the speculation is whether there is likely to be a third wave. When will it arrive? Where will it arrive? And how severe it will be is a matter that's being hotly debated and discussed by the scientists, by the media, and by a public which is still very alarmed at the prospect. But there are several learnings from the earlier waves that we must actually imbibe and apply if we want to deal effectively with the prevention or even with the appropriate response to the third wave. Firstly, we have learned that the mode of spread involves both droplets and aerosols, something that we did not acknowledge in 2020, which means that masks are absolutely needed whenever persons are outside the house, and particularly in indoor environments where ventilation is limited. We know that super spreader events are dangerous, that when crowds gather, along with them, the virus celebrates. When people travel, along with them, the virus travels. And therefore, the amount of opportunity we provide to the virus should be as limited as possible. We know that herd immunity is a misleading concept which lulled us into complacency early this year when we felt the first wave had given us enough herd immunity and therefore we are never going to get it again. Firstly, herd immunity is a population attribute, not an individual attribute. We do not even know what the threshold of infection has to be for herd immunity to be arrived at in this population. But even if, let us say, 60% of a particular population group acquire immunity through natural infection, that may not be long-lasting because the viral load is very variable in a natural infection, and therefore the immunity may wane fairly soon in a few months. But even more importantly, the people who are not immune, either by way of natural infection or by way of vaccination, but are protected by the cordon of people who have acquired that immunity, while they are within that particular community or a place, if they venture out of that protective cordon to another part of the country or even another part of the city or another country, that protection is no longer available to them and they can still be infected. That is why it is important that for every person to acquire that immunity, preferably by vaccination rather than by infection, because infection itself may give a very variable level of immunity because of the very variable level of the viral load. Therefore, vaccination becomes an absolutely important element. But we have also had lessons for the health system. We cannot build a swift and strong surge response unless you have an efficient and equitable health system functioning even in the steady state when there is no emergency. How can we achieve our sustainable development goals or universal health coverage if we have a weak health system which is going to be constantly threatened by one emergency or other and fails to deliver the needed services even when there is no emergency? So all levels of the healthcare system are important to strengthen, but we have learned that ventilators and intensive care units alone will not help. That's the lesson of the first wave and even of the second wave. We know that we have to strengthen our primary healthcare system, both rural and urban. We know that we have to strengthen our secondary hospitals, particularly ensure that they're never deprived of oxygen and they have enough beds to deal with many of the cases who do not need advanced care. But we know that 80 to 85% will benefit from home care. So we need to strengthen home care arrangements, particularly through good primary healthcare systems. We also require that, and we need this primary healthcare systems not only in rural areas, but in urban areas, because urban primary healthcare has not really taken off through the urban health mission as yet. But we also recognize that citizen participation and center-state coordination are both vital elements. It cannot be always a top-down approach. It has to engage all elements of the society, and also it has to have a harmonious working relationship between the center and the states. These are some of the lessons we have learned over the first and the second waves. But vaccination is vital because it gives you a standardized dose of antigenic exposure, which gives you a reasonably long-lasting and strong immunity. And that is where your herd immunity or herd protection can come in handy. And now there is reasonable amount of evidence. If you cross the 60% threshold of vaccination in any population, the likelihood of viral transmission to others also comes down markedly. And we have an example even from Brazil, where in the province of Serrana, the moment a 60% threshold of vaccination was crossed, 95% reduction in the deaths and 86% reduction in infections was noted. So we do need to hasten our vaccination and spread it fast and farther. And that is one of the important priorities for the next part of the year. So we do recognize that we are also being challenged by variants. And there is a concern about variants, that a number of new variants are keeping up. But that is the nature of the virus to mutate, particularly when it finds obstruction to its easy transmission. It will try and mutate to overcome them. But it is for us to recognize that whether it is the original virus or the old variant or a new variant, and now people are worried about Delta Plus, apart from Delta, which is the dominant variant now, there are only 3 ways in which the virus can enter our body: the nose, the mouth, and the eyes. If we have adequate facial protection, if we avoid crowds, if we move in well-ventilated areas, and if we prevent super spreader events, then the virus, whether it is the Delta variant or the Delta Plus variant, cannot get easy access to our bodies. And that is where I believe our preventive measures must be very strongly mounted, both through public education as well as committed action by the policymakers. But we must also speed up our vaccination simultaneously so that we do provide as much protection to the vulnerable people first, essential workers as well, but extend it to other parts of the population and perhaps over a period of time, even children. There is some concern whether some of the variants are likely to have reduced response to the vaccines. It is quite clear that at least as far as the Delta variant is concerned, even though there is some reduced efficacy of several of the vaccines, the amount of immunity provided is reasonably protective against severe disease and death. So everybody must get vaccinated at the earliest opportunity that is offered. But there are several new vaccines on the way, which are not only looking at the spike protein, but they're looking at some of the interior antigens of the virus, and they are unlikely to be affected by the mutations. So some of these newer vaccines may arrive in the world after October or so. So there is enough strength in science to counter the ingenuity of the virus. And therefore, I do not think we should lose heart. What we need to do is to act with fortitude and confidence that we can actually counter this virus, provided we adopt cautionary behaviors and push our vaccination program soon. How long will this last? Will it affect children? There's been, again, a lot of speculation. I do not believe children will be preferentially targeted, but because most adults would have by then been vaccinated or acquired immunity through an infection, less of them would be available as susceptible individuals for infection, whereas children would still be very much exposed. And therefore, you may see more numbers of children being infected, but not necessarily with greater severity. But whether it is pediatric care facilities or adult care facilities, we must utilize this opportunity to strengthen our health system, which has been long overdue. And we must ensure that some of the inequities that exist between states in terms of healthcare facilities and health programs, right from prevention and health promotion to primary care, secondary care, and tertiary care, all of that is now going to be addressed by health system strengthening efforts. And if we do that countrywide, we'll be able to mount a very strong response, because we must recognize that weakness in any area, any province, can result in problems for the other parts of the country. Therefore, it has to be a unified countrywide response, strengthening the health system everywhere. And we must utilize this opportunity to put in more resources to build up a larger health workforce, better healthcare facilities, and ensure that our governance system of healthcare is much improved, so that we can achieve not only control over the pandemic, but also meet our universal health coverage goal and the sustainable development goals. Finally, I would like to say that there are also ecological lessons to be learned. These pandemics are not one-off events. In the last 60 years, there have been many new infectious disease outbreaks where microbes have traveled from animals to humans. That's not because animals have suddenly become malevolent towards human beings. It is because we have created conveyor belts by thoughtless deforestation, unplanned urbanization, and modifying our food and agricultural systems into factory scale animal production for livestock, for meat production. There are many things that we have done which has upset the ecological balance and has forced as well as enabled microbes living in wild animals of the forest to enter our veterinary populations and human populations. So we need to build much stronger health systems, but also take effective preventive measures with the ecological sense of responsibility. And therefore, there is much that political leadership of this country can do to achieve all of these objectives. And I trust that the political leaders and the people who are leading public life in this gathering will take inspiration from the landmark accomplishments of P.V. Narasimha Rao Garu and Dr. Manmohan Singh Ji in ensuring that the future of the country is going to be safe and that we will have to address not only the needs of the present generation, but the needs of the future generation by investing in health and environment in a sustainable manner. As the Nobel laureate for literature, Toni Morrison, said, if we do not create the future, the present extends itself. We cannot afford a weak and passive response. We need an active and assertive response to create that future, not only for ourselves and our younger generation, but possibly for the future generations to come. And that is the message that I would like to take from this event, where the memory of a great Prime Minister is being commemorated, and I've been graced by being gifted the award by another great Prime Minister. Thank you very much for this.
Thank you very, very much, Professor Srinath Reddy Garu. You made us all so proud. We already are proud of you, but you made us much more today by that very, very enlightening speech that you gave about today's major problem, that is the COVID, the current scenario, and the future challenges. Yes, I think the takeaway from your speech basically is that the health systems have to be improved at the primary, secondary, and tertiary levels, and also to make sure that we have an ecological balance, and that matters a lot. And the vaccination, the importance of vaccination. Thank you very much. It has been very, very helpful to, I'm sure, to whoever has been listening to you today. Thanking you once again. Now I call upon Shri Manikam Tagorji, the young and dynamic MP, 2 times MP from Tamil Nadu, who is also our AICC Secretary in charge, to come and give his message. Thank you.
Thank you, Gitaji. Respected former Prime Minister, Dr. Manmohan Singh Ji, respected Leader of Opposition in the Rajya Sabha, 𝐅𝐨𝐥𝐥𝐵 Kharge Ji, PCC President, Captain Uttam Kumar Reddy Ji, Member of Parliament, newly elected, appointed Telangana PCC President, Revanth Reddy Ji, MP, Chairperson of P.V. Narasimha Rao Centenary Celebrations Committee, Dr. Geeta Reddy Ji, and the PVN Lifetime Achievement Awardee, Padma Bhushan, Dr. Srinath Reddy Ji, Shri Manohar Rao Ji, former Union Minister Pallam Raju Ji, and the other committee members, Sridhar Babu Ji, Mahesh Gaud Ji, Mallu Ravi Ji, and all other friends. I'd like to thank the Telangana Congress Committee for organizing this centenary celebrations for the past 1 year. Particularly, Telangana Congress under Uttam Kumar Reddy Ji formed the Centenary Celebrations Committee a year back to celebrate former Prime Minister Shri P.V. Narasimha Rao's Centenary Celebrations for the whole year. Many events were organized by the team, and former Prime Minister P.V. Narasimha Rao is an example about Congress organization which groomed him to from a Congress worker to the Prime Minister of India. Prime Minister Rao had passed two important legislations in my view. One is the Panchayat Raj Act, which Kargeji mentioned, and the second thing which I felt was the Mandal Commission implementation, which was pending for long years. 27% of reservation for the OBC in the central government jobs. Youth of India must understand how he took steps to make India grow slowly but in an organized way. History will always remember our former Prime Minister, PV, for standing as the political support to Dr. Manmohan Singh's economic liberalization, which set for the next generation reforms. Beloved Prime Minister, former Prime Minister Rao, he is one of the greatest sons of Telangana, and we are happy to witness another son of Telangana, Dr. Srinath Reddy Garu, being awarded the Lifetime Achievement Awards today. I appreciate from the AACC the hard work of the Centenary Celebrations Committee of Dr. Geeta Reddy ji, Sridhar Babu ji, Mahesh Gaud ji, Mallu Ravi ji, and Hanumanth Rao ji for working in the COVID time to make this Centenary celebrations a very important one. Thank you all.
Thank you, Manikam Tagore-ji. That was really very sweet and short. I'm happy that you have participated in spite of your busy schedule. Now, I would like to invite, though we have all been together in one state, the erstwhile Andhra Pradesh, today we have to call him our guest, our neighbor. That is Mr. Pallam Raju Garu, who was a Union Minister for Human Development Resources, which is a portfolio that even P.V. Narasimha Rao Garu held. So I call upon him to give his brief message, and I feel that 3 minutes would be ideal, and I think it's nice that our Manik Tagore-ji has set the pace. So I invite Mr. Pallam Raju Garu.
Thank you, Geeta Reddy Garu. Chairman of the P.V. Narasimha Rao Centenary Celebrations, Srimati Geeta Reddy Garu. Honorable Chief Guest of the function, Dr. Manmohan Singh ji. Honorable Leader of the Opposition in Rajya Sabha and Senior Leader, Shri Mallikarjun Kharge ji. Recipient of the award, Dr. Srinath Reddy Garu. Shri Manohar Rao Garu. General Secretary in charge of Telangana, Shri Manikam Tagore ji. PCC President, Captain Uttam Kumar Reddy ji. Senior Leader, Shri Jana Reddy Garu. The new PCC President, Shri Revanth Reddy ji. Senior Congress leaders, including Shri Jana Reddy Garu, Shri Ponnal Lakshmaya Garu, and others who are present in the function, and ladies and gentlemen. At the outset, I would like to thank the Geeta Reddy Garu and the committee for giving me the opportunity to be a part of this function. As a person who's had an association for 3 generations with late Shri P.V. Narasimha Rao Garu, and being a proud successor of his in the Human Resources Development Ministry, I'm privileged to be participating in this function. I would also like to thank Dr. Srinath Reddy Garu for the enlightening talk and on a topic that is so relevant for the times, and all the precautions that we must take in order to avoid the brunt of the anticipated third wave. Shri P.V. Narasimha Rao Garu's birthday function and his anniversary, his death anniversary functions have been regularly held in Andhra Bhavan, Delhi, to which Dr. Manmohan Singh has been a regular visitor. And having worked with him, I think remembering the two major contributions, significant contributions that Dr. P.V. Narasimha Rao ji did for the country was the economic liberalization, which unleashed the true potential of the country, and the other important decision, in my view, is in establishing the Look East policy in forging a close trade link with our neighbors. Although Dr. Manmohan Singh ji, tried to strengthen that by preparing the ground for the being a member of the Regional Comprehensive Economic Partnership, it is unfortunate that the present government could not bring it to a proper conclusion. The other significant contribution of Dr. Shri P.V. Narasimha Rao ji has been in heralding India as a prominent nuclear power with the measures that he took as the Prime Minister for detonating the nuclear bomb, which was subsequently detonated during Vajpayee ji's time. He was very clear on the nuclear deterrence policy and also in the responsible usage of nuclear power. And the steps that he took towards the detonation of the bomb really heralded India into the super league of nuclear powers. There are a number of contributions that he has done in his various ministries, and one of the significant things that he did in the Human Resources Development Ministry was the establishment of the Navodaya Vidyalayas, Jawahar Navodaya Vidyalayas, which gave access to residential facilities for students in every district, a residential facility that was comprehensive and from where some of our brightest students come out. Even today, the best performing schools in the country are the Jawahar Navodaya Vidyalayas. I would have liked to have a term as long as he did to make a significant contribution in that sphere. But I would like to end my speech by thanking Dr. Manmohan Singh and our leader, Srimati Sonia Gandhi, who gave me the opportunity to be the successor of P.V. Narasimha Rao Garu in that portfolio. Thank you and Jai Hind.
Thank you very much, Pallam Raju Garu, that you made us feel that we may be geographically divided, but we are still a one state in a way. We are the Telugus and we are together. It was a nice message that you gave us. Now, I would request the following speakers, అందరినీ నేను రిక్వెస్ట్ చేసేది ఏంటంటే కొద్దిగా మనం 1 hour టైమే తీసుకున్నాము ప్రధానమంత్రి దగ్గర. We took 1 hour's time, but then టైం షార్ట్ అయిపోతా ఉంది బాగా. అందుకని నెక్స్ట్ స్పీకర్ ఇక్కడ లేరు కానీ వారు ఖమ్మంలో ఉన్నారు. సిఎల్పి లీడర్ శ్రీ బట్టి విక్రమార్క గారుని మాట్లాడమని కోరుతా ఉన్నారు. హ్యాస్ హీ లాగ్డ్ ఇన్? నో? I then next invite our mana senior nayakulu, most senior nayakulu in Telangana politics, Shri Janareddy garni vachi మీరు మాట్లాడితే దానికి అందం వస్తుందన్న, ప్లీజ్ రండి, నేను ఇన్వైట్ చేస్తున్నా, మీ సిస్టర్గా నేను మిమ్మల్ని ఇన్వైట్ చేస్తున్నా, కమ్ అండ్ గివ్ యువర్ మెసేజ్, ఐడ్ బీ వెరీ హ్యాపీ. 1 నిమిషమా 2 నిమిషాలు అది మీకు వదిలేస్తాను నేను.
శతజయంత్యుత్సవ అధ్యక్షులు శ్రీమతి గీతారెడ్డి గారు, కార్యక్రమంలో పాల్గొన్న ముఖ్య నేతలు, ఆ తర్వాత ఈరోజు ఈ కార్యక్రమం యొక్క చీఫ్ ముఖ్య అతిథి మాజీ ప్రధానమంత్రి మన్మోహన్ సింగ్ గారు, ఇతర పెద్దలు ఖర్గే గారు, మాణిక్యం గారు, అందరికీ ఈ సందర్భంగా నమస్కారం, ధన్యవాదాలు తెలియజేస్తూ, ముఖ్యంగా కాంగ్రెస్ పార్టీ పక్షాన తెలంగాణ రాష్ట్ర కాంగ్రెస్ పార్టీ సంవత్సరం నుంచి వివిధ కార్యక్రమాలు నిర్వహిస్తూ ఈరోజు ముగింపు సమావేశాన్ని కూడా చాలా గొప్పగా మీరు నిర్వర్తించినందుకు మన కాంగ్రెస్ పార్టీ అందరినీ నేను అభినందిస్తున్నాను. ఆ తర్వాత వారందరికీ ధన్యవాదాలు తెలియజేస్తున్నాను. దానికంటే ఇక ప్రధానమైనటువంటి విషయం మీ అందరికీ తెలుసు. మాజీ ప్రధానమంత్రి పివి నరసింహారావు గారు వారి యొక్క ప్రత్యేకతలు మీ అందరికీ తెలిసినటువంటి వాటన్నిటినీ నేను ఏకరువు పెట్టిన అవసరం. ఆయన సంఘ సంస్కర్త కాదు, మానవతావాది, బహుభాషా కోవిదుడు, భాషావేత్త, సాహితీవేత్త, వీటన్నిటికంటే పరిపాలనా అధ్యక్షుడు. అనేక విపత్కర పరిస్థితుల్లో ఈ దేశానికి, ఈ రాష్ట్రానికి ఆయన చేసిన సేవలు గర్వించదగ్గాయి. అంతకంటే తెలుగు బిడ్డగా మనందరికీ గర్వకారణం. అటువంటి వారి యొక్క ఈ ఉత్సవాలు జరుపుకోవటమే కాదు, వీటి ద్వారా స్ఫూర్తి పొంది భారతదేశంలో రాజకీయ నాయకులతో పాటు సమాజం వారిని స్ఫూర్తి, నిజమైనటువంటి వారి ఆశయాల్ని, ఆలోచనల్ని మనం రంగరించుకొని వారికి ఆ స్ఫూర్తిని పొందటం ముదాం. అందుకు ఆయనకి ఈ సందర్భంగా నేను ఘనమైనటువంటి నివాళులు అర్పిస్తూ వారి స్ఫూర్తితో ముందుకు సాగుదాను. సెలవు.
పొన్నాల లక్ష్మయ్య గారు
క్షమించాలి సమయం తీసుకుంటున్నందుకు. సమయం ఇప్పటికే అయిపోయింది. పెద్దలు మన్మోహన్ సింగ్ గారు, ఖర్గే గారు, అదేవిధంగా పల్లం రాజు గారు, ఈరోజు అవార్డు తీసుకున్నటువంటి డాక్టర్ శ్రీనాథ్ రెడ్డి గారు, ఇంకా ఇతర పెద్దలు, పిసిసి అధ్యక్షులు ఉత్తమ్ కుమార్ రెడ్డి గారు, ఈ నిర్వహణ సంవత్సరం చేస్తున్నటువంటి అధ్యక్షురాలు, సంఘ అధ్యక్షురాలు గీతారెడ్డి గారు, వారి సభ్యులు, సోదరులారా, సోదరిమల్లారా, నేను కావాలని అవకాశం తీసుకున్నాను. 48 సంవత్సరాల కింద మొట్టమొదటిసారి పరిచయం అమెరికాలో మాజీ ముఖ్యమంత్రిగా. వారితో కొద్ది రోజులు చర్చించడం, తిరగడం, తిప్పడం ఒక అంశం. రెండవది, ఆయన పోటీ చేస్తున్న పార్లమెంటు నియోజకవర్గంలో 1980 కానీ 84 రెండిట్లో ఒక అసెంబ్లీ నియోజకవర్గానికి ఇన్ఛార్జిగా, ఆ ఎన్నికల్లో పనిచేసిన వాడిగా ఒక్క నిమిషం మాట్లాడదామని వచ్చాను, కానీ వేరే ఉద్దేశం కాదు. ఎన్నో పర్యాయాలు, ఎన్నో సందర్భాలు ఇవి చారిత్రాత్మకం. కానీ గతంలో కూడా ఈ సమావేశంలో మాట్లాడాను కొన్ని విషయాలు. ఆర్థిక, సామాజిక, రాజకీయ కోణంలో దేశ పౌరులందరినీ సమానంగా చూడడానికి, దేశ పౌరులందరికీ సమాన అవకాశాలు కల్పించడానికి ప్రభుత్వ పరంగా చేసిన ఆలోచనలు కానీ, ప్రణాళికలు కానీ, ఇది ఒక చారిత్రాత్మకం, ఇది స్ఫూర్తిదాయకం. ఇది మరింత వేగంగా కొనసాగించే విధంగా మన ప్రభుత్వాలు చేస్తూ వచ్చాయి. దాన్ని దృష్టిలో పెట్టుకునే ఈరోజు వారికి మనం ఘనమైన నివాళులతో పాటు ఆ స్ఫూర్తిని ముందుకు తీసుకెళ్ళడానికి మన కార్యక్రమాలు శాశ్వతంగా ఉంటాయి అని, ఈ దేశం, ఈ సమాజం, కాంగ్రెస్ పార్టీ విధానాలు, కాంగ్రెస్ పార్టీ కార్యక్రమాలు ఆ దిశలో కొనసాగుతున్న నేపథ్యంలో ఒక మారుమూల గ్రామం నుంచి ఒక శాసనసభ్యుడిగా ఎన్నికై ప్రధానమంత్రి స్థాయి వరకు వచ్చినటువంటి పివి నరసింహారావు గారి చరిత్ర తెలియంది కాదు. కానీ ఇది కాంగ్రెస్ పార్టీ యొక్క గొప్ప కంట్రిబ్యూషన్ అనేది, గుర్తింపు అనేది, తద్వారా కాంగ్రెస్ పార్టీ దేశానికి చేసిన సేవలు అనే విషయం ఈ సందర్భంగా తెలియజేస్తూ ముగిస్తాను. ధన్యవాదాలు గీతారెడ్డి గారు. థ్యాంక్ యూ.
సభకి నమస్కారం. మీ అందరికీ తెలిసిన విషయం, గౌరవనీయ ఉత్తమ్ కుమార్ రెడ్డి గారు పోయిన సంవత్సరం పివి నరసింహారావు గారి శతజయంతి ఉత్సవాల కమిటీ ఏర్పాటు చేసి ఇప్పటి వరకు జరిగిన కార్యక్రమాలన్నింటి కూడా చేయూతనిస్తూ ఈ సంవత్సరం పాటు జరిగిన కార్యక్రమాన్ని విజయం చేయడానికి దోహదం చేశారు. పివి నరసింహారావు గారి జీవితం ఒక తెరిచిన పుస్తకం. ఆయన జీవితం మనందరికీ, ముఖ్యంగా కాంగ్రెస్ వారికి ఎప్పటికి కూడా ఒక పాఠంలాగే ఉంటుంది. సెంటనరీ సెలబ్రేషన్ కమిటీ ఇవాళతో ముగుస్తున్నా, నేను పెద్దలు గవర్నర్ ఉత్తమ్ కుమార్ రెడ్డి గారు అన్నారు, పివి నరసింహారావు గారి చరిత్ర ఆ పుస్తకం ఎప్పటికీ తెరిచే ఉంటుంది. వచ్చే జనరేషన్స్ అన్నీ కూడా ఎప్పటికప్పుడు వాళ్ళు పేజీలు తింపుతూ చదువుకోవచ్చు, కానీ ఆ పుస్తకం ఎప్పుడు మూయబడదనే మాట నిన్న చెప్పడం జరిగింది. పివి నరసింహారావు గారి చరిత్ర ఎప్పటికీ ఉంటుంది, మన తర్వాత వచ్చే జనరేషన్గా ఉంటుంది. ఇవాళ ఈ కార్యక్రమంలో టైం ఇచ్చి ఇక్కడ వచ్చి అవార్డు ఇవ్వడానికి ముందుకు వచ్చిన పెద్దలు గౌరవనీయులు మాజీ ప్రధానమంత్రి గారు మన్మోహన్ సింగ్ గారికి, ఖార్గే గారికి, అవార్డు యాక్సెప్ట్ చేసిన గొప్ప డాక్టర్ శ్రీనాథ్ రెడ్డి గారికి, ఈ కార్యక్రమంలో పాల్గొన్నటువంటి మాండికం ఠాగూర్ గారికి, పెద్దలు గవర్నర్ మనోహర్ రావు గారికి, ఉత్తమ్ రెడ్డి గారికి, శ్రీమతి గీతారెడ్డి గారికి, వి హనుమంతరావు గారికి, నూతనంగా పీసీ అధ్యక్షుడు నియమించినటువంటి పాల్గొన్నటువంటి రేవంత్ రెడ్డి గారికి, బట్టి విక్రమ గారికి, ప్రసంగించిన పల్లం రాజు గారికి, పాల్గొన్నటువంటి ఏఐసి కార్యదర్శులు బోసరాజు గారు, శ్రీనివాసన్ గారు, అదేవిధంగా శ్రీధర్ బాబు గారు, ప్రత్యక్షంగా ఇక్కడికి వచ్చి పాల్గొన్నటువంటి పెద్దలు గవర్నర్లు జానారెడ్డి గారు, గవర్నర్లు పొన్నా లక్ష్మయ్య గారు, గడ్డం వినోద్ గారు, ఇక్కడ జరిగినటువంటి మెమోంటో గురించి పాపం 4-5 రోజులు కష్టపడి తానే స్వయంగా కరీంనగర్తో మాట్లాడి, లేపాక్షులతో మాట్లాడి చక్కటి కరీంనగర్ అంటే పివి నరసింహారావు గవర్నమెంట్ కరీంనగర్లో పిలిగిరితో చేపట్టిన మొమెంట్ ఇవ్వడానికి ముందుకు వచ్చిన గడ్డం వినోద్ గారు, ఈ కార్యక్రమాన్ని చూస్తున్నటువంటి శ్రవణ్ కుమార్ రెడ్డి గారు, పెయింటింగ్ వేయించుకొచ్చినటువంటి శ్యామోహన్ గారు, అంబాజ వినోద్ గారు, వేణు గారు, మల్లు రవి గారు, నిరంజన్ గారు, అదేవిధంగా ఈ పెయింటింగ్ వేసినటువంటి గీతా భాస్కర్ గారు, ప్రతిభా దాల్ గారు, అన్నిటికీ మించి ఈ సంవత్సరం పొడుగునా ఈ కార్యక్రమం ఎంత చక్కగా జరుగుతున్నాయంటే దీనికి కారణం కేకే రాజా గారు, మేడం ఈ ఈవెంట్ మేనేజర్ కేకే రాజా గారు, ఈ కార్యక్రమం అన్ని రకాలుగా చూసినట్టు దీపక్ జాన్ గారు, పిఆర్ఓ హరి గారు, వీరితో పాటు ఈ కార్యక్రమం సహకరించి అందరికీ కూడా పివి నరసింహారావు కమిటీ తరఫున మనస్ఫూర్తి ధన్యవాదాలు తెలియజేస్తూ ముగిస్తున్నాము. జై హింద్. ప్రోగ్రామ్ ఇస్ బిన్ క్లోజ్డ్.